welcome back to High Spirits, exploring the energy around us. I'm your host, Christine Pettit, and I'm here today with Heather Mogilnicki, the owner of Healing Hands Therapy Center in Collinsville, Connecticut. Welcome.
Thank you. Thank you for having me.
Well, thank you for being here. And this is our second installment of our discussion with Heather about the healing energy that she uses in her occupational therapy practice,
Yes.
and the different modalities that she incorporates with the science and the training that she has received from our traditional schools with other mentors and leaders in the spiritual arena that have brought extra modalities of alternative therapies, which you may not want to use the word alternative, but we can get into that. But just more integrative healing modalities that incorporate mind, body, and spirit a little bit more than our semi-traditional Western medicine often does. So welcome.
Thank you.
And thank you for the discussion that we just had on our last episode about what you do. If you could give us a brief overview once again, if anyone had not seen that, about what you're incorporating and who you work with, and we'd love to hear about that.
Okay, sure. So my first degree is as a professional musician. I was a professional flute player. I had injuries that I had to stop playing, so that's how I came upon occupational therapy. And what I loved about occupational therapy was that it was very mind, body, spirit oriented. So I wasn't really sure that that's what I wanted to do, but I ended up, everything just sort of aligned, and I ended up going to school for it, and I got out and I got a job immediately right in orthopedic hand clinic, which I knew I wanted to do orthopedic upper extremity stuff. So I became a certified hand therapist, and which really just means entire upper extremity. And then I treated there for about 17 years and always felt like something was missing. And then I went on to train and open up my intuitive psychic energy healing abilities on a deeper level with an incredible psychic mentor. And now I integrate the traditional science world of therapy with the energetic healing as well. So
very cool. Now, how did you find the person to bring the science and add those extra energetic healing aspects? How did that show up in your life?
So it was, again, you know, the universe will just bring us things when it's in alignment for that to happen. So it was a chance meeting. I had a meeting with another friend who knew this woman, and she was just, the things that she was saying, I was like, how does she know all this? It was actually a business meeting. She's a business, she coaches businesses. So we were meeting with her, and I was like, how do you know all this? And at the end,
things about you?
Yeah, well, just things in general about, you know, our business and me and that kind of thing. And I was like, how does she know all this? And she said to me, well, I'm psychic. And I was like, wow, okay, I get it now. So I just started, you know, following her on her social media, and then I started working with her, and then I did a very intensive year-long program with her to tap in and open up my abilities. So.
And the word psychic, when you use, we did discuss, you mean using other faculties?
So you're using, everybody has psychic abilities. Everybody can read and feel energy. It's just a matter of how much do we pay attention to it and how much do we tap into it and fine tune it and use it for the highest good, and open those abilities up. So it really does require training and opening them up and figuring out how to use it in the modality that you're meant to use it in. So it's just a matter of tapping into the universal energy or the energy of the person that you're working with.
Now, some of the energy healing modalities that people may have heard of before, they may be familiar with Reiki, for instance. And that's not what you do, right?
It's not what I do, but it's similar.
So to back up a little, so now Reiki is, the idea is that you're using universal energy to that would flow through you, divine energy, source energy, whatever terms are big
terms
on the show.
Big.
Yes. So whatever term you use for the larger sense of whatever is around us, and directing it to the person to use their own energy to balance and equalize the energies in their body.
Yes.
And the chakras are what they're balancing.
Yes.
So before you tell us how what you do is a little different, I know that you're a little familiar with chakras.
Yes.
And could maybe explain that to us so that we get what is being worked with and how a little bit.
Right. So, there's many, many chakras in the human body. The most
what
common
is a
ones.
chakra?
So a chakra
an energy
is,
center.
It's an energy center, yes.
Okay.
So, and there's 7 main ones that most people know about, which are your crown, your third eye, your throat chakra, your heart chakra, your solar plexus, your sacral chakra, and your base chakra. So those are the main ones that most people kind of have an idea about. So when I work with people and do energy healing with them, I'm sometimes it changes. It depends on how I'm working with them. There's times that I will be working with their physical body, but also doing energy work. So I may be stretching a joint. I may be mobilizing a joint. I may be doing a lot of manual therapy, but I'll also be working and moving the energy around what's going on. So I look at the physical body and what their diagnosis is, the issue that they came to me having, and then I look at where the energy is coming from and where it's stemming from a physiological aspect, as well as a deeper subconscious emotional aspect as well. So,
and each of those energy centers represent something a little larger, like third eye would, I mean, could you run through
Sure.
the,
Yep.
and also each corresponds with a color, with a music note. There's many different aspects and ways that they can be worked with.
Yes.
And you work with kind of what they represent. Is that correct?
Yeah. So each, and teaching about the chakras is, a couple hour at least.
This is a Google it.
So we're gonna
situation.
do a really quick overview. So like your crown chakra is all about pulling in your consciousness and pulling in information. But most of our crown chakras in this day and age they're huge and they're open, and it's all like brain chatter, mindset chatter that just kind of bounces back and forth. But it's also a channel to your third eye, which is all about seeing. So tapping into the things that you're seeing and that you're meant to do. Your throat chakra is all about speaking your truth. And this is just very global. So your throat chakra is, all about speaking your truth. And obviously it's in your throat area. And I just touched my mic, so I'm sorry. Probably made that sound funny. Your heart chakra is obviously love. It's also sense of purpose as well. Your solar plexus is your belly. And, each chakra corresponds to the area of the body too. So neck, sinuses, sometimes with the chakras, with the throat chakra kind of come from here down. Your crown chakra and your third eye can be headaches and things like that, your hair, that kind of stuff. Heart chakra is obviously your heart, lungs, those kinds of things. Solar plexus is your stomach, right? The solar plexus is all kind of about standing in your power, your truth, right?
And that's where anxiety
tends to live in the solar plexus. Absolutely. Sacral chakra is, your reproductive organ area. It's also about masculine, feminine energy and the balance of that. And base chakra is all about our stability, our security. That's the pelvic area, kind of your coccyx bone area, like, your legs, your hips, the sits bones, and that's all about, your sense of security, stability, safety, that kind of thing. So that's kind of it in a nutshell, but they all work together. So
before we move on to how they work together, I just wanted to sort of explain. So when you're manifesting pain in any of these areas, that could correspond to some trauma in that region, or if you sense something's out of alignment or unbalanced, there could be, a lack of love in the heart, or an ache or something, so it doesn't mean that there isn't any, or that there's some issue. It could be a self-love. It could be, a loss of a love or something like that. So the idea would be you'd you'd have some heartache, literally, and then, okay, well, why, right?
Right.
You're looking for the deeper reason behind, and then fixing it not only physically, but incorporating that energy along with it.
Yes.
Okay.
Yeah. Yep.
Okay. Just as so how you would work.
So, and I think we gave the example I was telling you about when we were talking about reading the energy of that patient that my colleague had. Well, what was going on with them actually was, I felt a lot of issues in their lungs, difficulty breathing. That was the physical sensation that I was getting that they were having.
So you're going to feel in your body. This is how it presents for you.
For me,
Explain how that.
Yeah, I will feel certain tensions and things in my body where they're feeling it.
So it'll correspond to their issue,
Yes.
and that's how you know where to work.
Yes,
Okay.
that's one of the ways that I know how to work. Well, this person I said, there's something really physically wrong with this person's lungs. Well, it turns out that they have pulmonary embolisms.
Wow.
So, so that's heart chakra and throat chakra, so you've got here down. So more heart chakra area, but it depends on where you kind of cut that line. But there was a lot of tension right in through here, down into here. So, so each one kind of corresponds to different body parts, and it's not a cut and dry black and white,
Of course.
but that's
Not much of this is.
no, not much of it is. No.
This is a nice gray area all around.
It is
Okay,
true.
very cool.
yeah.
So now to discuss a little bit about what you were doing with the patient, my understanding is that you don't need to physically have the patient in front of you to work with their energy. Can you talk a little bit about that? Because I know in this day and age, a lot of the appointments that we're getting in Western medicine are online. They're on Zoom.
Yep.
You can talk with your doctor quickly. It's very convenient.
Yeah.
But I don't know how many tests can be done in our traditional medicine via Zoom. You still have to go get the blood work. You still have to come in, and they need to feel if
They
they're
need to
swelling,
listen
et cetera.
Right. Yep.
So energy healing, does that work over Zoom? How does this add or detract from the practices?
It does. And that's one of the really cool things about it. And that was one of the things that I think I'm very much a manual therapist. As a traditional occupational therapist and working in orthopedics, I'm very manually based. I use my hands all the time. I'm constantly working with people's tissues.
Yes, massage, manipulation, all kinds
so
of
it's all kinds of different
touch.
things.
Okay.
A very touch-oriented practice. But when it comes to energy healing, you do not need to. It's just like with that client that I was reading for my colleague. They weren't anywhere to be seen. It was just looking at that energy. We also worked on another client together. Actually, it was a friend of hers, and they were having numbness and tingling in their hand. And we just worked on the energy of where that was coming from, where it kind of tracked in their body, and releasing that. And their numbness and tingling actually went away. So I don't know who that person is. We just called up their energy, and she told me what the person's symptoms were. So you can do it virtually, and I also do it in person. It kind of depends on what the person wants, but you can absolutely do it virtually. And you've had experience doing things virtually, working with energy as well. So
I have. Yes, I was recently trained in Reiki levels 1 and 2, and Reiki is using the energy around us and within us to heal our own bodies.
Yep.
And it was a Zoom course. And I could feel the Reiki, I could feel a little buzzing, I could feel energy within my body. And when I asked, for instance, in my shoulder, and when I asked the person over Zoom what they had done, they said, I felt something in your shoulder, so I was working on that. And I never met this person. And
you didn't say I have a shoulder thing, right?
No discussion before. You're paired up, you go, you got 2 minutes, you finish.
Right.
And how does that work? It's amazing.
It is amazing.
I basically wanted to learn more about it, so I took the courses.
Yeah.
And I'm all in now. I mean, because when you see for yourself, and you're doing and you're receiving, giving and receiving, it's amazing the benefits on both ends.
Right.
But what I also experienced was with you. We can talk a little bit more about the deeper travels and journeys and things that you do in terms of Well, you actually I probably should have you explain the modalities that you work with, because you have the 2 sections in your office.
Yeah.
One is a table in a nice quiet room with some crystals and nice lighting. And
it's a traditional therapy treatment table.
Yep, correct.
It's just the ambiance is a little bit different than your standard.
Right. So you're
office,
using standardized therapies, and you're integrating these other modalities that are going to bring the full picture into view. So we were working for a few times on my hand issues from being a musician and from the work I was doing. And we got to a certain point where it was, well, you can explain.
So, yeah, I mean, it got to a certain point where we were sort of stuck a little bit, right? So we needed to go a little bit further. And again, this is where when you work, part of the really important thing is when you're working with energy, and when you are, when I know we talked a little bit about channeling, but when you're reading the energy of the person or you're channeling, you channel in that moment in time, right? And then you clear your energy so that you're not taking on the energy of the other person. That's really important. I know that when I was treating like 18 patients a day when I was working at the health center, I would go home and I would be exhausted. I had no idea how to clear my energy.
Oh, so what do you mean by clearing your energy?
You take on energy of other people.
Okay, so you're working with them, you're removing this, you're kind of taking it in yourself.
Well, you don't take it on, but you still have to clear
explain a little
it.
with that.
Okay.
Clear, what do you mean by clear? How?
So if you think about when you, during COVID, and you would go to the grocery store, right? And how awful you would feel when you went to the grocery store, and you would go home and you would just feel like, ugh, right? Do you remember that feeling?
I do.
So that's taking on energy, right? So you took on the energy. Yeah, you took on the energy of that environment, right? So I would come home and I'd like clear my energy, just energetically clear my energy, clear that off of me. So it's a lot of visualization. It's working and moving energy on my own body,
which is what you do in your practice.
Which is what I do in my practice. Yeah. So when you're working with clients, it's a matter of you working with them, but then you're making sure that you're leaving that energy. You're throwing it back to the universe. You're not taking it on with you, and you're not giving anything back to you. So like when we've moved energy and we've cleared things, we don't want to give back what we've cleared because we've brought in something different. Anytime you remove limiting beliefs and negative energies, you have to pull in and replace it with something of a higher vibration, right? Because it's just, otherwise the ick stuff will come back. Right?
Even on a simple level, changing your mind, changing anything, you have to change it to something else. So you're leaving behind and you're adapting new.
Right. Okay. Yep. And that's a whole other topic, is mindset and energy. We should have a conversation. We have a lot of topics, yeah. But anyways, what was your question? Oh yeah, so you were asking me about the journeys that I did with you. When I channel, I don't take it with me, and I don't remember. So remember the girl that had the issues with her hands. I don't remember what questions I asked her, because in that moment they're just provided to me, right? Like I channel those questions, so I don't remember a lot of specific stuff.
And that's what I want to know a little more about. Channeling and getting in touch with their energy and receiving information, basically.
Yes. Yep.
From what? From who? From where?
Right. So you always want to be, and this is why training with somebody really good is important, because you always want to be working in the highest of good and working at the highest vibrational level you possibly can.
How can you assure that that's happening?
By training and setting your intention and really practicing.
So intentional
and
mindset
and working your own energy, clearing your own energy, doing your own healing on a daily basis.
So clearing your own energy, one way is grounding. Can you explain what that would be?
So when I teach patients how to ground and my clients how to ground, it's really calling your energy back. If you think about,
what's grounding?
So grounding is pulling your energy down into the ground so that you're feeling more stable. So when you call your energy back throughout the day, you throw your energy out everywhere, right? It goes here, it goes there, it goes here.
My son gets a little bit of it. I can feel that.
Yeah. Oh yeah, I give mine to my
job
kids,
gets it. My dog gets it.
Yeah, everybody gets it, right? Mm-hmm. And it can be exhausting. So it's all over the place. So you really just want to pull only your energy back into your center, right? And then take that energy and kind of visualize grounding it down through your legs, through your feet, and into the ground. So it really just pulls yourself back into yourself.
Why?
So that you can move forward and make decisions and be in better alignment. And also
clarity.
Clarity is a huge one. Clarity is a huge
clearing your energy can give you clarity of mind, of purpose.
Yep.
Okay.
Yep.
Okay.
It's one level of it. It's the very first level of that purpose and getting into alignment. Yeah. Okay.
Right. So when we worked together, we only have a few minutes left.
Okay.
But I do want to talk a little bit about where that information comes from. Now, you mentioned that you would be able to speak with their guides, with the people that, and what is a guide?
Oh, now we get into the woo-woo aspect of it. So you're stretching me. And
That's okay. I'm pushing you.
Yes. So we all have guides that we work with that are help us on this journey through life. Right? Spiritual guides, yes. Right? So this is the spiritual aspect of things. And so I will use my guides to help assist in the healings that I do. They help protect the space. They help protect the person that I'm working with. They help protect me. They give me guidance. So guidance, right? So when I'm channeling the energy of your guides, of you, of higher universal guides that are for everybody, right? So it's a matter of pulling in that energy and reading that energy to work with. It's a very hard thing to explain.
Here's what I have, and Kat, this is my little view of what I think through working with you, what I think goes on.
Okay.
And this goes back to the idea of the word psychic and what's really happening there. My take is that you work with your guides. I'm here with my guides. The guides talk to each other. Mine tell yours what's going on with me. Yours tell you what they just said. And it's like you read my mind, right? But you didn't.
Right.
So that's how I look at it. You're working with this energy, which is really people, kind of, translating it to you in a way you're going to understand it. So that's my long and short. I don't know if it's really how it works, but it feels like that's how it works to me.
That's how it works, yeah.
So, but they are able to tell you things you would never know, right? And maybe even stretch you into things you didn't know you could do. Does that happen?
Yes, absolutely. Okay. Yeah, because I remember when I first started doing this and training, I was always amazed. I would call my mentor up and I'd be like, I have a client, and I wouldn't even say anything else, and she'd be like, blah 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 blah, tell me all about the client. I'm like, how the hell do you know that? Am I allowed to say that?
Yeah.
And with training and practice, I realized that now I do that. Which is really such a huge asset to be able to help work with people, right? Because you can look at the different levels of their healing to help bring it up. And so much of what I really love to do, as well as not just the physical stuff, is to really work with getting people to come into alignment with their soul's purpose, because so many of us are trying to figure out what we're meant to do and what is our purpose. And sometimes that shifts and changes as we go through life. We have a general purpose, but we kind of navigate around, and coming into alignment with that and clearing the stuff out of the way, the limiting beliefs, and doing the healing around all that to help people kind of forge forward into that pathway is hugely rewarding.
Well, the world is better off for the work that you're doing.
Oh, thank you.
Because you're bringing such positive energy out of people, and you're filling them with your positive energy, and you're very good at what you do, because I was able to go back to work and I came in being told I couldn't. So thank you for that and for today. Yes. It was really, really wonderful learning a little bit more about how we can integrate these standardized science, Western viewpoints of medicine with a larger, all-encompassing, holistic approach.
Yes.
So it's wonderful having you right on Main Street in Collinsville, Connecticut, actually. So Heather's practice is on 111 Main Street in Collinsville, healinghandstherapycenter.com. And is there anything else you'd like to add that we didn't touch on?
I think I think as we move forward, healthcare is changing dramatically. It's falling apart and it's going to be rebuilt. And the energy of healthcare is changing. It needs to, because people are not happy with how it has been. They all are feeling that something is missing. It's just trying to bring awareness to what that is. And they're tired of being treated like a number. Which again is multifactorial in terms of why that has occurred. But I think it's really important moving forward to really incorporate both aspects of the science and the energy.
Absolutely.
So.
I agree. Thank you for being with us today on High Spirits as we explore the energy around us and within us today. See you soon.
Nick Augustino right here at the East Side Restaurant. We always have the complete full dinner menu. Knockwurst, bratwurst, sauerbraten, potato pancakes, red cabbage, rice pudding, cream pies, all the desserts that Germany had to offer. I always do something different. Yes, I do. I brought seafood to the beer garden at the East Side Restaurant. East Side Restaurant, your German destination restaurant in Connecticut. Tiki-taka, hoy, hoy, hoy!